Hello everybody, this is Dr. Alexander, plastic surgeon and cosmetic surgeon from Kinder Hospital, the Department of Plastic Surgery. Today I am going to introduce you to the field of plastic and cosmetic surgery. One of the commonest questions that is asked by people is, what is cosmetic surgery? For this we have to understand what is plastic surgery. Basically, plastic surgery is derived from the word plastic, which comes from the Greek word plastikos, which means to mold. And the idea is to mold tissues so that we get the tissues that have been lost or displaced or damaged or excised through surgery. For example, if a patient's nose has been lost, then we have to get the tissues that are able to create the nose, and that becomes part of plastic surgery. What is then cosmetic surgery? Cosmetic surgery is an integral part of plastic surgery, because in cosmetic surgery we try to improve the appearance of a person or a part of his body by using the principles that we have learned in plastic surgery. So basically, cosmetic surgery is an integral part of plastic surgery. We often wonder what are the commonest surgeries that we do in cosmetic surgery. Liposuction is one of the most commonest type of surgeries that is being done all over the world. So what is liposuction? Liposuction is actually basically sucking out the fat through a keyhole surgery. In this, what we do is we make a small incision in the body where we need to suck the fat out. We inject some fluid that will help to make the fat suckable out, and then we put some suction force on it. And there are different ways to do it. We can use laser techniques, we can use radio frequency techniques, we can use simple suction techniques, and we take the fat out to get a cosmetic appearance of that part. Liposuction is used in different parts of the body. It can be used on the arms, it can be used on the legs, on the thighs, it can be used on the abdomen. So it can be used in different ways wherever you think the fat is troubling you. And it's often combined with other surgeries. For example, liposuction is commonly combined with a tummy tuck. Now, what is a tummy tuck? Basically, when you have a protuberant abdomen, whether it be a female or a male, what we look at is the part that is causing this abnormality. So it can be, you can have a lot of fat on the abdomen. You could have a muscle weakness that has occurred. Maybe after 2 or 3 pregnancies, the abdominal muscles are very weak and need to be corrected. And third, there might be excess of skin that is still hanging on. Some people lose a lot of weight and you have a lot of fat that is hanging down and skin excess that is there. So in a tummy tuck surgery, we actually tackle 3 aspects of it. One is the skin element, where if it is excess, we need to cut it out. If the muscles are displaced, then we need to correct the muscles. And the third thing is where the fat is there. And if the fat is excess, then we have to do liposuction on that. So tummy tuck will depend upon the type of problems that is involved with that particular position or part of the body. We can also do it on the limbs as doing a thigh lift. Sometimes you have excess of fat on the thigh, and so we do a thigh lift. It can be used on the arms as well, where sometimes you have fatty arms and you're embarrassed to wear a sleeveless dress, so we can do a liposuction and do it. There are other surgeries that we commonly do in cosmetic surgery, and this is regarding the female breast. So sometimes the breast size is very large, and what we do a reduction, it is called a reduction mammoplasty. At times the female breast might be very small and she might be quite embarrassed with the size of the breast, and then we have to put in silicone implants. So we try to enlarge the size of the breast. This is part of the cosmetic surgery that we do. At times the breast size may be normal but may just be hanging down, and the patient may be actually embarrassed because of that. And what we do is we raise the position through a cosmetic surgery which is referred to as mastopexy. Other surgeries that we do include rhinoplasty. Now, what is rhinoplasty? It's actually sometimes the nose might be misshapen. It might be too long, it can be short, the dorsum of it might be depressed, or the tip might be very bulky, and then the patient might be very uncomfortable with the shape of his nose. So we try to do 1 or 2 elements depending upon surgeries, depending upon the part that is involved. If the skin is a problem, that will need correction. If the cartilages are a problem, that will need correction. And if the bones are a problem, then we have to break the bones and do osteotomies. So all three aspects are combined. And sometimes you have a problem of breathing as well. And therefore we have to do surgery with the septum. So often it's referred to as a septo or rhinoplasty then. So basically we are correcting the shape of the nose, and we are also improving the airway problem if it exists. One of the other parts of plastic surgery or cosmetic surgery that we do is concerning the ear. A lot of people, when you look at them, look very pretty and handsome, but their ears tend to actually stand out. And we refer to them as bat ears, because if you look at the ears of the bat, they're really wide and really pointing outwards. And what we do is a correction for the ears, which is referred to as the setback surgery. So ear correction is under part of cosmetic surgery that we often do for the patients. There are other surgeries also that we do in plastic surgery, and as I said about breast surgery, we can also do it on the male breast, which is referred to as gynecomastia. When you have a large male breast, and you often have the young kids and young adults that are very embarrassed to walk out into the swimming pool or remove their shirts in front of their peers because their breast size are big and look like feminine breasts, then we do surgery for that. Often we combine liposuction depending upon the element of skin that needs to be excised. So gynecomastia correction becomes an integral part of our plastic surgery and cosmetic surgery. A lot of times patients have scars over their body, and these scars can be depressed, they can be elevated, they can be hypertrophic, they can be colloidal, and we often treat them with different techniques. Sometimes we use injection of certain steroids into these, sometimes we use surgery for them, and sometimes we use other pressure garments or other things that may be needed to reduce. So scar corrections become an integral part of our plastic surgery. Plastic surgery and cosmetic surgery are so vast that we can actually utilize it to improve a person's self-confidence and improve his appearance and make him more happy to live his life and to be in a good working environment where he can be successful. So I think if you have a problem, do approach a plastic cosmetic surgeon and get whatever is needed to improve your self-confidence and live happy. You feel free to post them in the comment box below, and we shall be very glad to reply to your queries.